Hello, and thank you for tuning into this video blog about a publication that I'm sure you'll be keen to learn more about. The publication title is An Economic Case Study of the Control of Dog-Mediated Rabies by an Animal Welfare Organisation in Jaipur, India. And this was published by Andrew Larkins and his colleagues in the second half of 2020. One of ICAM's active projects at the moment is building the argument for why dog population management is important. So answering the question of how do we build the political will and the commitment to sustain humane and effective management. When ICAM read this publication, we got really excited because it's a very positive economic assessment of the impact of Help in Suffering's humane and long-standing dog population management in Jaipur. And economics is, of course, really important to government and politicians, but an economic assessment of dog population management is a rare and therefore very valuable thing. So today we have two of the authors from this publication. We have the lead author, Andrew Larkins, and we have Jack Reece, and we also have Sanjay Singh. And Jack and Sanjay are from Helping Suffering and are involved in the implementation of the actual dog population management work in Jaipur. And together we will be exploring this publication in more depth. Now, we are talking together from 3 different continents, so please do excuse the momentary break in internet connection towards the end of our discussion. I am Dr. Elly Hiby, and as the director of ICAM, my job is to bring you those things that I believe will make us all more effective in our humane dog and cat population management work. So I hope you enjoy the discussion of this potentially really influential paper. Right. Good morning, everybody. Thank you so much for joining me today. And I'm looking forward to having this chat with you about the publication. But first of all, let's go around our little virtual room so that everybody listening knows who you are. So first of all, Andrew, could you introduce yourself, please?
Hi, I'm Andrew Larkins. I'm a veterinarian in Western Australia. And I worked on this project as part of my Masters of One Health at the University of Edinburgh, doing an economic assessment of the animal birth control work at Help in Suffering.
Lovely, thank you very much. And Jack, could you do us a little introduction?
Hello, I'm Jack Reece. I'm a British vet, and for 20 years I've worked at Help in Suffering, which is an animal welfare organisation in Jaipur, India, and mainly been involved with the ABC programme controlling street dogs and rabies in the city.
Lovely, thank you very much. And then finally, if we can go over to Sanjay, please.
Hello, I am Dr. Sanjay Singh. I am a veterinarian and I work at Helping Suffering, which is a charity works for animal welfare. I mostly involved in animal birth and rabies control program with Dr. Jack Reece.
Perfect. Thank you. That's great. Right. I would like to learn a little bit more about the publication itself. So, Andrew, can I ask you to kick us off by just giving us a brief sort of summary of the findings of your economic assessment of Help in Suffering's ABC work in Jaipur, please?
Yeah, sure. So what we did, this was, as I mentioned, part of my master's degree. And I'd just quickly like to acknowledge Michael Thrasfield and Alexandra Shaw, who aren't in on this call, and of course Jack, who are the other co-authors on the paper. And what we did was use existing data about the dog and the human populations in Jaipur, and then estimated the cost of rabies in people, and compared this to a scenario where ABC hadn't been operating. And essentially, really the key finding from the work was that the ABC program can be considered very cost effective when you use the World Health Organization's cost effectiveness guidelines.
Perfect. Thank you ever so much. And I was looking actually at the paper this morning and remembering that the amounts are fabulously high. We're looking at sort of a societal benefit of 38 million over that 23 years, which is fabulous, really great. Now, economic analysis of dog population management are is very rare, and that's why this is so very valuable and why we want to talk about it today. And I was interested if you had opinion on why that is. Why is economic assessment of this work so rare, and what was it about helping suffering and Jaipur that made this possible for you to do?
I'd say it's probably rare because it's hard, and it takes time and money and effort, unfortunately, and really all of the credit and this whole project was possible thanks to the data collection over 25 years now, led by Jack and the rest of the Helping Suffering team, like Sanjay and Nirmal, who kept meticulous financial records that we could link to the outcomes from the ABC project. But like I said, really trying to make time to collect some data and have a plan for what you want to do with it is really the start of things. Collecting data is hard, but it doesn't need to be perfect. But you need something, and the data in this analysis has lots of limitations and assumptions. But you can do something with data, but you need it. And I think this study really showed what you can do if you do start collecting things.
That's great, thank you. And I have to say, from ICAM's perspective, Helping Suffering is always one of those organisations that we want to champion and congratulate, because this is the longest term data set that we know of for dog population management. It really is a fabulous and persistent and professional effort they've made over the years. So big congratulations to Helping Suffering. Now, Jack, I wanted to ask you a quick question, because to my mind, one of the reasons why this economic assessment was so positive is because your work, your ABC work, has been noted for being very efficient, really very low cost. And I was interested whether there were particular areas that you've worked on over the years that have helped you bring your costs down.
I don't think the cost side of things is something that our financial director gets involved in more than me. And there isn't very much that we have specifically done to keep costs down. I mean, we are lucky in that India is a fairly low cost place. Things generally don't cost very much in India. I personally think that probably one of the biggest savings, given that manpower costs are so high, is that we run our program with quite efficient manpower. Many programs, certainly in India, because of various social rules, have whole hierarchies of people who won't do various jobs or will only do certain jobs and not other jobs. And therefore you have a whole array of people who clean kennels and feed dogs and anaesthetize them and look after them and do surgery on them and all that sort of thing. Whereas our program is run with our vet techs and veterinary surgeons, and between us we do everything: the husbandry, the veterinary care, the data collection, the monitoring, all of it. And I think that probably is the main thing. We haven't got great layers of staff doing relatively little work.
It sounds like a very slick team. It's a good way of working. And of course, you've got a reasonably high throughput as well, haven't you? You're collecting, what sort of numbers of dogs are you getting most days?
Well, we do about 3,500 spays or sterilizations a year, and another 4,000 or 5,000 vaccinations. So we're handling, what's that, about 8,000 dogs a year. So that's, what's that, 25 a day? I haven't worked it out per day, but it's about 8,000 a year.
That's very good, thank you. And that's actually, you brought up an interesting point there, which is the fact that you're doing both sterilisation and vaccination together, and then you're also doing some vaccination alone. And Sanjay, this was a question actually I wanted to ask you. Now, I understand that you apply these different approaches differently according to the sex and the age of the dogs. And I wondered if you could explain for us a little bit more of the thinking behind that strategy, how you apply the sterilisation and vaccination to this dog, but vaccination only to this dog. How do you choose which approach for which dog?
Yeah. Actually, there are couples of reasons. So we'll go one by one. Okay, if we go through, if we talk about the dog population, if you want to control a dog population in a city, town, or in a specific area, as we do, we should start focusing female first. Actually, the reason is, if we are doing one female, if we are not doing one female, okay, the litter will be around 8. And if you go 50-50, there is 50% male and 50% female. If you don't do that 4 females over there, after 8 months, there will be litters, there will be plenty of pups or plenty of. So if you really want to control a dog population in a city or town, you should focus on female. And the other thing is, as you are asking, the age. If we talk about veterinary science, if we are doing a big adult males, the anatomy, it's a big scrotum and having a big testicles. If you remove the testicles from the scrotum, you are leaving a big dead space into the body. And according to Hofstede principles of surgery, there should be no dead space when you're doing surgery. They will swollen up. Overall, there are post-op complications are higher in adult males. So what we do, we choose to do all age of females. So we say all age of females, and we do young males, 8 months, 9 months, or just below 1 year. After that, if there are big adult males, we just vaccinate them against rabies. And the third one is active sex ratio. In a town or in a city, there should be some adult males. That's the strategy of doing. That's why we are saying our ABC program is focusing on female. We mostly do females. Yeah, more than 70%, I would say.
That makes sense. So you're focusing on those females because they are the limiting factor, really, aren't they, in the population? But then doing this vaccination only to bring that herd immunity up so that your coverage is great, which is, I guess, why we have these great reductions in rabies cases as well. That's great.
And the other thing is, as I talked in ICAM conference in Kenya, the dog bite cases, reduction dog bite cases, it's a maternal, what do I say, maternal protective behavior. If from 1993 to 2018, there is a huge reduction in human dog bite cases. It was from 7.2 dog bite per 1,000 cases to 2.2 dog bite per 1,000 cases. Yeah. So if we are removing the maternal behavior, maternal protective behavior, so there would be no dog bites. So as Andrew Larkins did the great job in his papers, it's all one health concept.
As Sanjay said, we found that there was this seasonality to dog bites in Jaipur, which mirrored the seasonality to dog breeding in Jaipur. Now, I think it's probably an exaggeration to say that all of the dog bites are related, that would be eliminated if you removed all the maternal behaviour. Some dogs would bite some people some of the time, but clearly there was some of the human dog bites were related to bitches protecting their pups, and the peak was 10, 12, 16 weeks after the peak whelping date, which is about when young puppies are running about, exploring their world. And of course, young puppies, well, anecdotally, young puppies are very attractive to small children. Children like to grab hold of them and play with them, and they are very cute. Unfortunately, that means that particularly children are at risk, particularly young boys on the streets are at risk of being bitten by maternal mother street dogs protecting or looking to protect their puppies. So that was a sort of unexpected, we can't say we set off to do that. That was an unexpected finding from our ABC program. But given the extraordinary numbers of dog bites that they predict in India, which I think is 17 million a year, in many ways, dog bites are a much bigger public health problem than rabies, which affects very, very few people.
Thank you, Jan. That's a great answer. And I'm interested actually to also, I don't know whether this is a question more to Jack or to Sanjay actually, how did you find the collection of the data around dog bites? Because that's often something that organisations may struggle with. Where do you get that dog bite data from, and what's that process of collecting it?
We are lucky around, we are running program in Jaipur, and it's the capital of Rajasthan, and in the same city in Jaipur there is SMS hospital. It's a big hospital. It's a big, very big hospital with medical college. Okay, so they are teaching students over there. Actually, they are having a department who deals with all sort of bites: dog bite, cat bite, monkey bite, horse bite, or all sort of things. Public health. They do have OPD register there. Actually, it's hard to get data over there from there, but we managed to get data. We did earlier and we stopped in the middle. We did not have data, and then we again in 2018 we took data from over there. Yeah, so we had data and we analyzed again. So I think in 1993 to 2011, if I'm wrong, Zach can correct me, the dog bite reduction was 7.2 dog bite to 2.7. And when we did it again in 2018, it reduced again. It comes on 2.2 dog bite per 1,000 people. Yeah.
That's great. So that reduction has continued even from that last publication. That's really, that's good news.
Yeah.
Great.
Yeah.
Well, congratulations on having, good professional relationships with the hospital to get that data. And I can imagine that has taken some years to build those relationships and trust for data sharing. So well done for achieving that.
Quite a lot of the data had actually been published by medics from the Bite Hospital. I think it was in the Association for Prevention and Control of Rabies in India journal, because they have clearly got an interest in this matter, and they had the medical doctors at the hospital had published it, and we just took that data and did other things with it.
Then the kudos is to them for reporting that data. That's great. Okay. So going back to Andrew, obviously being able to do these economic assessments, we've talked about the significant amount of data collection effort that Jack and Sanjay and colleagues have been doing over the years. And I'm hoping that some organisations that are listening to this will be inspired to maybe try the same with their own DPM interventions. So I'm guessing from what I'm asking is, from your perspective, what would you say to an organisation like that about how to prepare for doing such an economic analysis? What should they get ready?
Really, I think you need to sit down before you even start collecting the data, which is easy to say and nice to say, to sit down and think about what you want to try and achieve. What are you trying to show with any sort of analysis, and what do you have available at your fingertips? Is there data that you're already collecting that can slot into analysis, and what do you need to go out and get? or as Jack mentioned before, what might you need to go to existing publications for, which in the analysis that we did on the economics, we used quite a lot of data from published literature to fill in the gaps about costs and things like that. But really in economics, you're comparing costs and comparing benefits. So it starts with trying to list all the different costs and benefits that are associated with your intervention and seeing which ones of those you can capture and which ones you can't. You're never going to be able to capture all of them, but getting as many as you can and the key ones there is really important. Start reading and speaking to people involved with other interventions and see how they're going about it. It's often personal relationships and things you find in the literature that lead to these sort of projects.
Thank you. That's great. You made a really interesting point there. We were talking about how to access data from the outside on impacts in terms of rabies cases and dog bites and so on. We've talked about that, but you made a good point there about, as an organisation, you have a responsibility yourself to keep good data on what you've been doing, the amount of effort you've been putting in year on year, and how much that costs. And I know that that's something that Helping Suffering also had done very diligently, and you had that information at your fingertips to be able to do that economic assessment. So that obviously is a key factor in being able to do this in Jaipur.
I think it's really important that you need to be able to show that there's some benefit to what you're doing. It doesn't necessarily have to be a dollar value, but you need to be able to show that you are impacting the dog population in your area. Otherwise, you can't expect funding bodies to keep giving you money unless you can show them this is the impact that we're having, which Helping Suffering have done an amazing job of.
Yeah, so there's a good point. So we're looking at the impact you're having on the dogs themselves, and actually that Sanjay, I wanted to ask you a question a little bit about how you implement your street surveys at the moment, because Helping Suffering basically has, I think, the longest running roaming dog survey that at least ICAM know of, and we've always been very impressed with the commitment to doing those surveys every year that you guys have shown. So can you tell me a little bit about what implementing street surveys looks like in Jaipur these days?
We Helping Suffering the dog survey in Pink City twice in a year, in March and in October. And we try to do last week of March or last week of October, early morning, 5:30 to 8 o'clock in the morning. We go through, actually we do the index of evidence. So what we have done, we just, we divided city in 6 groups, 6 small sizes, and we does every day one size for one colony. So we walk through there, we have a seat. So there are, per 4 miles, male, castrated or vaccinated male, female, spayed female, pups, lactating females. We count down them over there, and we do this regularly. Actually, we missed this survey last year in March when this COVID just happened, but and we just finished in this March. We have done it again in this March, last month. Yeah, so we have data again, but what's the main what's the main thing in data collecting? You have to do it in one way. You cannot change things. You can't do it. Once you are doing in March and then you decided to do in April. No, you have to do in March, so you can compare your data. So, yeah.
Excellent point. Yeah, you're absolutely right. So the street surveys that you've been implementing are really monitoring surveys, looking at changes over time. And you're so right. You've got to be absolutely dedicated to that method and stick to the same protocol year after year, so that you can make those comparisons. Now, Jack, you've been doing these. Is it now 20 years that that the street surveys have been running, how did you maintain the motivation to keep doing them in the early years when you were really one of the only organisations putting that effort in? Rather these days, thankfully, lots of organisations are doing these surveys.
Well, our ABC programme was set up in part to test the WHO guidelines on street dog control. And one of the things that was decided before I got to Help and Suffering that would need data collection on was population size. So we just sort of established a way of doing it and sort of took advice from wherever we could get it, which really wasn't very easy right at the start because nobody had ever done it. And then, I mean, once we'd sort of set up a system for it, it was simply a question of doing it. And as Sanjay says, you know, we've tried to eliminate differences in season, you know, climate, time of year, breeding, all that sort of thing, so that the results are more comparable. As far as motivation was concerned, well, it was just one of those things one had to do. You know, it's, you know, like, you know, putting a clean shirt on every morning. You know, just one of those things that's part of the job. Personally, for motivation, I have found it much more difficult recently, in recent years, because we have discovered through the work that Lex Hiby has done, that we could actually collect data of similar scientific value with considerable less effort than we put in at the moment. And Dr. Sanjay has been doing motorcycle surveys following on from those that Lex Hiby did, which collect equally good data of this sort, but don't involve getting up at 5:30 every morning for 6 mornings at a time and walking for 3 hours in the city, and doing that twice a year. And I'm afraid I have found that much less, it's been much harder to motivate myself. But luckily Sanjay hasn't been doing it so long, so he still finds it easy to get out of bed at that time of the morning.
Thank you, Sanjay. And I'm going to do a momentary plug to say that ICAM have a new survey tool out now called Talea. So if you want to learn more, check out our website and you'll see that there's a mobile phone app to make these surveys even easier. I know Sanjay's been using similar applications, and it definitely makes life simpler if you can just click a button on your phone to keep track of the dogs that you see. So take a look at that. Now, going back to Andrew for a second, you noted in your conclusion that you'd looked at several benefits related to the ABC to do with human health. So you're looking at dog bites and rabies cases principally, but that you didn't include in the economic analysis some of the other benefits that may have been occurring in terms of dog welfare and in human-dog relationships. I was interested, did you try to quantify these at all in Jaipur? And could you imagine ways that benefits like this to do with dog welfare and human-dog relationships, or just dog density, could have been included in future analysis? What kind of data were you potentially looking for?
Yeah, so we didn't try and quantify any of these sort of benefits in this project, mostly because it was part of a master's, so there were limits on time and money. So we were trying to use data that was already readily available. This project didn't actually take any additional data collection other than NERML producing financial reports, which I transcribed onto the computer. In terms of measuring those sort of things, it can be difficult to try and measure the value in either relationships between human and animals, and the value of non-livestock animals. But you certainly can measure animal welfare indicators. there's a variety of literature out there about what you can measure. And if you're using any sort of ectoparasite treatment as part of your population management program, you can do skin condition scores when you're out there doing your motorbike surveys and looking at body condition scores and things like that. So certainly groups have done that. And groups have gone even further than that and done sort of focus group interviews with people living in areas where the intervention's happening and seeing what their relationship is like with dogs in the area. And there's a great paper looking at trying to capture all of the benefits. And I think that one was based in Sri Lanka. But yeah, you certainly shouldn't not try and capture these sort of benefits. You just need to recognise that some people are going to put a different value on these sort of things, and yeah, it's about trying to decide what you want to achieve. And what we were trying to do was look at whether animal birth control programs could be cost effective in the fight against dog-mediated rabies, because there's a lot of publication out there and a lot of analysis done that mass vaccination campaigns are the way to go, and they certainly will always be cheaper than animal birth control programs, but it doesn't mean that animal birth control programs that are already existing aren't cost effective in their own right to control rabies. And that's really what we were trying to show. Not too many groups had done that using real data. Most of it had been done through modelling, but we, thanks to Jack and the guys at HIS, we had real data. This is what happened on the ground. It wasn't too many complex mathematical models to get what we found.
Yeah, that's great. Yeah, you brought up an interesting point there, and it's something that ICAM just discussed as well. When we're looking at effective rabies control, we know that mass vaccination is a very cost-effective way of reducing rabies cases, but of course in India the ABC approach is legally mandated, and that's why Help in Suffering worked in that way for all that time. And of course the impacts that has had isn't therefore not just on the human rabies cases, but on dog bites as well. As Jack mentioned earlier, you've had this great reduction in dog bites, and that's not just because of the reduction in rabies, that's also changing the likelihood of maternal aggression or maternal protective behaviour, and also just there being less dogs, so a reduction in the roaming dog density, and that's something that couldn't have been brought about with just mass vaccination. So it's got these added benefits. Jack, I wanted to ask you, because we've probably got quite a good perspective on this. Obviously, the ABC has had these great impacts on rabies control, but what else have you seen that has changed in Jaipur as a result of this ABC work? You say it's been 20 years now, so what have we not covered so far that you've seen change?
Got no data, but my feeling is that the dog-human relationship has changed. There are far more people being prepared to adopt and look after Indian street dogs than ever there were when I first went to India. People had pet dogs, but almost nobody kept a street dog as a pet. And now we see quite a lot of what are sort of by breeding street dogs, but they're keeping them as pets. And indeed, occasionally we get people telling us that actually the ABC has been too successful because there aren't any street dogs in their street. And they like having street dogs about. So I think that's probably the main sort of additional benefit that we've had. Now, some of that probably would happen anyway, because even in cities, big cities in India, have all seen quite dramatic rise in pet ownership. So I suspect some of that would have happened anyway, but perhaps some of it is happening because people appreciate that these dogs are now safe and that they have seen help in suffering, showing that we consider they have some worth by investing in them, and that sort of raises their value in everybody's eyes.
And do you think they appear different? I mean, is their visible welfare different? If I'm going to pull from my memory now, there's another paper that looks at your work in Jaipur and compares it to other cities where ABC isn't happening, which I think is Andy Yoke's paper. Mm-hmm. And if I remember rightly, he was seeing differences, was it both in body condition and in skin condition between the dogs in the different cities?
Yeah. And Andrew Yoke, who was a PhD student from the United States, he compared the street dogs in Jaipur with those in Jodhpur and those in another city in Rajasthan, Swamadipur. And why there'd been a sustained ABC program in Jaipur, there'd been a mass intensive effort, but for a very much shorter period of time, on street dog control in Jodhpur, and there'd been no work done in Swamadipur at all. And he looked at 10 different indicators, measures of welfare, health of street dogs, things like whether they'd had distemper, mange, body condition score, wounds. What else did he look at? Ehrlichia. Oh, I can't remember. Leptospirosis. And he found that for 7 of them, there was a neat hierarchy where a long ABC program, as in Jaipur, made the dogs have were healthier for 7 of these measures. The Jodhpur program, which had been in existence for 4 or 5 years, had sort of the middle position, and Swamadipur dogs, where nobody had ever paid any attention to them, were, I think, for all of them, all of these 10 measures of health and welfare that he looked at, the Swamadipur dogs were the worst. Mm. So that suggests that ABC not only affects the dogs that have been through the program, the sterilised and vaccinated ones, but that it also measures, it improves measurements of welfare and health in the general population of dogs, including those that haven't yet got to the program. The dogs he looked at were dogs entering the ABC programs. So they were the entire unvaccinated, hadn't yet had any benefit from coming to us, but they all had, because their neighbours were healthier, because there were fewer of them and their neighbours were healthier, they too were healthier.
Yeah, that's brilliant. Thank you. That was a great summary of that paper. So, obviously, this publication has shown a really significant societal economic benefit. So we're talking about 38 million over 23 years. So that's a really significant saving for the health service in Jaipur. So I was interested to hear from you what you think the potential implications could be of these findings in India.
Yeah, if we talk through the Andrew Larkins conclusion, as helping suffering ABC program saved quite $1 million or many lives. I think if I talk about India, Indian municipal corporation also or other organizations should implement animal birth and disease control program, because we are at the end we are reaching at one health concept. If we are reducing human dog bite cases, we are managing to lose a big number of money or if we are losing some human lives because of rabies, if we can prevent them through the animal birth and rabies control program, so why not we? So I think all organizations or municipal corporations should apply this or implement the animal birth and rabies control program, or government should fund the organizations like Help and Suffering, or any other organization who are doing the work in this way. Yeah.
Thank you. You did a really good job then of bringing this back from, it's not just monetary, is it? It's actually saving people's lives. And the estimate that comes out in this paper is that 500 human deaths have been averted through the ABC work, and that's really significant. So I hope you're right. I hope this paper does inspire more municipal corporations to invest in ABC, whether it's themselves or whether it's through organisations like Help in Suffering, because you've done this very well, very professionally and very efficiently over this period of time and saved a lot of money for the Indian government. So, and
there are good examples, aren't there, where health departments and those charged with street dog control work together very well. I think Sri Lanka is one of them, isn't it? And Bhutan would be another. And they should be championed, because the big problem is that the medical authorities don't know about this, and there isn't a sort of cross fertilization and a saving of lives and money in this way.
Unfortunately, we've just lost Sanjay at the end there. The internet has failed us momentarily again, but yeah, it's a good point. You're bringing up this, as Sanjay said, this is a One Health program. It's working with animal health for the benefit of human health, and other countries have done this very well as well. And this is a perfect example from India, but there are examples to be found in countries like Sri Lanka, and also Latin America have done a very good job with their rabies control over the years. And that was born out of a strong intersectorial working on rabies, with that One Health concept leading the charge. We have Sanjay back, hopefully. I wanted to finish by just giving each of you a chance, if you had any sort of final comments that you wanted to make, or final points that you wanted to bring out from the publication that you think people should be keen to remember. So any final words?
I will say we could not have done largely most of our papers, but particularly this one, without input. And Andrew's work on this got something published that there would no way at all would we at Help in Suffering ever have managed this if he hadn't waded in and done all the amazingly complicated economic stuff, which went right over the top of my head and still does, frankly. So I think a really big thank you to Andrew for pushing on with this very considerable amount of work.
Oh, well said. Okay, well then that just leaves me to thank you all. I really enjoyed discussing this publication with you today, and I hope our ICAM audience enjoy reading it and they get to be excited about the concepts and the ideas and the findings from this publication, and go and read it and hopefully use it in their own work from this point forwards. So thank you all. Thank you, Andrew. Thank you, Jack. Thank you, Sanjay. And bye for now.